And welcome back to Newsmaker Sunday. E-cigarettes come in many shapes and sizes. Some commonly used by youth can even look like pens or flash drives. They come in kid-friendly flavors. In 2018, the CDC and the Food and Drug Administration showed that more than 3.6 million youth had at least experimented with vaping. This included 1 in 5 high school students, 1 in 20 middle school students. Doctor, is enough being done to try to keep these vaping devices out of the hands of kids?
The short answer is no, absolutely not. So again, you look at statistics and look at these numbers. When we talk about, the FDA initially made a statement about this back in November 2018. At the time, they had quoted a number of 21% of young children, or I call them young children, but that's what they are, right, that were vaping. This number now went from 21% to 28%. This is in the space of not even a year. Another startling statistic is that 8th graders, this 10% of all 8th graders vape. Now here's another sobering statistic for you. Kids who vape, who are 8th graders, they have 10 times the chance, if they were to vape, for them to graduate to actual smoking cigarettes. That's as far as I'm concerned, that's a public health emergency. That is a huge big deal.
And ironically, 10 years ago or so, when this vaping started, the advertising marketing spiel was that these vaping devices will help you quit smoking cigarettes.
I'm glad you brought that up, because there's no data to support that. There's no good clinical data to support that. The FDA has not approved those devices for that indication. As a matter of fact, one of the larger companies did receive a warning letter from the FDA to stop making those claims. And if I'm not mistaken, in May of next year, they should be reviewing the data, and then the FDA would make a ruling as to whether or not where to go with this, essentially. But no, there is no solid data out there to say that that is the case.
We're going to take a look at our local kids and vaping and smoking. Several local cities have taken action to ban vaping in public spaces, but one area school district is going a little bit further. They're teaching the students about the dangers of vaping, and Local 5's Aaron Taylor has more on what students in the Mishicot School District will be learning this year.
It's business as usual for Mishicot students, while district officials fight a growing problem.
Vaping is almost at an epidemic level. It's finding its way down to middle schools.
This year, 7th and 9th grade students will work through an addition to the curriculum.
We should be providing education to our students as well as parents on the dangers of vaping and the long-term health impacts for these adolescents that are using.
The 5-hour online course is aimed at educating students on the dangers of vaping.
I don't believe just in consequences in terms of trying to alleviate the problem.
Because Dr. Orlich believes part of the problem is how young people perceive it.
It's tutti frutti and Fruit Loop flavored.
Flavors, just one of many factors.
They're more easy to conceal now. They're readily available. The marketing is strictly toward kids. I mean,
the program is aimed at addressing those factors and the risks associated with vaping.
Adolescents in general sort of being more willing to take risks and not really thinking about how some of those negative health impacts will affect them.
They're hoping the program will help students think critically before they vape.
That they would be able to translate that learning into other settings out in the community at home, and when they're out and about with their friends, that they'd know that there's genuine health risks with engaging in this behavior.
In Mishicot, Aaron Taylor, Local 5 News.
Thanks, Aaron. So that's Mishicot. Doctor, do you think that should be a part of the curriculum for all of our schools?
I think so. I believe that it should be. I think this should be, though, a part of a more concerted effort towards this. I'll tell you one interesting thing. Since the 1960s, this country, one of the successes with regarding to combating smoking is that we did cut the smoking rate by half. Still significant, more than 400,000 people lose their lives in this country related to smoking every year. So that has been quite the achievement. these devices, we call them ENDS, these electronic nicotine delivery systems is what they're called. So vaping underneath the e-cigarettes, et cetera, it describes all of them. You know, they are delivering nicotine, that is their intent. And nicotine is one of the most addictive substances known to us. And it's also can be potentially lethal for a little child. So the concern is that now that we're reversing that success we've had or continue hopefully to have in cutting down smoking rates. Now you're looking at reversing it. So much so that there's data, strong data coming out suggesting that kids who are otherwise would have been at very low risk for smoking are getting into the vaping and likely graduate into cigarette smoking. That could potentially be disastrous for us as a nation.
It's like the old argument of marijuana leading you to harder drugs.
You know, it's interesting you say that. The ATS, the American Thoracic Society, in the statement they released, they categorically state they consider vaping as a gateway drug to smoking.
Cigarettes.
They use those exact words, gateway drug. So,
The vaping epidemic. We continue with our conversation right after this. Stay with us.